Hi dear friends, welcome back to my channel. Welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you see me for the first time, my name is Anastasia and I'm a pelvic floor physiotherapist who works in sunny Cyprus as well as online, and here I'm sharing all my best tips and tricks for pelvic health. I work with different populations, which is male, female, children, and also pregnant. And as you can see, and as you have actually guessed, today's video will be about pregnancy. I like to use this ball in order to replicate the pregnant states, because first of all it helps me to separate the videos that are for pregnant and non-pregnant population. Also gives me the feeling how to move when in a pregnant state. I have been pregnant myself twice, but it's been a while, so I have forgotten. And also I have noticed that I do move really more careful, a little bit differently when I'm also doing Pilates with my pregnants, with my wonderful pregnants. I actually think, why am I moving like this? I'm not pregnant, but they are. So I really want to show them, you know, how to move safely. Not that there is a huge massive difference, but some movements have to be a little bit more careful, a little bit more considerate, and also sometimes a little bit more slow. So today I will talk about diastasis recti, abdominal separation in pregnancy, because this is where it starts and this is where my population majorly comes from. With diastasis recti separation, I would say 95% of cases. There are 5% that are non-pregnancy related, male, female, children diastasis recti, but today specifically we're talking about diastasis recti, abdominal separation in pregnancy. Make sure you press a like and subscribe button not to miss any of my videos that I share all my best tips and tricks on pelvic floor. Let me know in the comments. Did you have diastasis recti? Have you noticed it in pregnancy? Have you noticed it after pregnancy? You've been lucky enough not to have any. However, about that I will tell you in a second. And let's begin. First, a small intro about diastasis recti. Diastasis recti is abdominal separation, so separation of the line that runs across your abdominals. It is connective tissue line. It's basically like a ligament, and it can stretch out in pregnancy as a baby grows. And actually it should be to some point stretching in a pregnancy and adapt. But there are really different reasons why in some people it will stretch more, why in some people it will not bounce back. It can be size of the baby, it can be the quality of connective tissue. Sometimes there is a slightly more chance of having diastasis recti after a cesarean birth, but we're talking now about the birth as well. But in pregnancy, there is a research that actually 100% of women will develop some kind of abdominal separation. There is no sure way to prevent it 100% and say, hey, do this and no abdominal separation. If I tell you that, I will be just plain lying, and I don't like to lie to my viewers and my clients. So abdominal separation is not 100% preventable. However, there are a few things we can do to help ourselves to keep good abdominal control, okay? And also, the most important, to prepare ourselves for rehabilitation. So as soon as the baby is out, the abs are relaxed and they're not getting stretched anymore by the growing baby, we can start actually heal them through exercises, through breathing, through movement. And this is why also we do these things in pregnancy, because if you do your preparation in pregnancy, you're 2 steps ahead postpartum. What do we need to learn to minimize abdominal separation, maximize abdominal control, and be ready and on the low start for post-pregnancy rehab? Breathing and deep abdominal engagement. A deep abdominal engagement comes also together with a pelvic floor engagement. And I would say this is it. This is the core, the main thing that you can use throughout any exercises. How does it look like? I'll give you an example in hands and knees, and in a high kneeling, so plainly, so I fit in the frame of the video, so I don't have to readjust and stand. Although you use this kind of engagement throughout on the 4-point kneeling, and because baby is growing, diaphragm, poor thing, is compressed and stretched and becomes not as effective as it should be, creates more intra-abdominal pressure, like there is not enough from the baby already, but it creates even more pressure because it cannot contract and relax as it should. More pressure, this pressure has to go somewhere, it goes out in front, more stretch of linea alba, of the white line, more diastasis recti. So what we need to do is really need to focus on our breathing. And our breathing in pregnancy, I do like to put pregnancy on the hands and knees. First of all, it kind of takes off the load from the spine. Okay, so the belly can relax here, takes off the load from the pelvis, from around the ribs. Of course, you can do it in any other position, but here is offloading position here. And we take nice deep breath into our sides and into our back. Okay, so we're taking nice deep breath, consciously sending the breath into our sides and back of our ribs. And breathe out. It should be nice long breath, 3-4 seconds. And you might feel that it's quite hard to do it so long. So let's try again. I'm going to be here on the one hand and count for you. So let's breathe in. Quite long, 4 seconds, okay? You should be feeling that you're filling up here the lungs with the air, and then breathe out. This type of breathing, diaphragmatic breathing with a focus at the side of the back, should be practiced daily and through all your exercises. If you don't exercise, I highly suggest for you to do some basic pregnancy exercises. I have a lot of them in my pregnancy list. You can find out for your hips, for your pelvic floor, and this breathing should be incorporated in all your exercises. Now let's add the pelvic floor. We do need to engage our pelvic floor in order to complete the core engagement and to have the best muscle activation. So doing your Kegel, gentle Kegel squeeze whilst you're breathing out is of paramount importance to activate fully your abdominals, because if you just breathe in, breathe out, and you engage only your abs without doing anything to the pelvic floor, you don't get those lower deep transverse abdominals fully activated if you don't engage your pelvic floor. So how do we do it? I will just, for a positional change, I will be here on my knees, okay? So I'm thinking about my pelvic floor around the area of my vaginal opening, anal opening, and in between. So I'm taking my breath in into the sides and back as I did before. And I breathe out, squeeze my pelvic floor, and do the belly hug. So you should be able to actually to see, okay? Not only to feel, but to see. Pelvic floor engagement, no, but the belly hug, the belly will be lifting up and in and kind of getting a little bit smaller. If you can sustain that pelvic floor squeeze whilst doing the belly hug, this means you're doing the correct activation. If you feel like you're doing the belly hug, but you're kind of losing the pelvic floor, then maybe your pelvic floor is a bit too weak. It's been overstrained with the pregnancy, and you can do basic pelvic floor exercises for pregnancy that I also have in my pregnancy list. But this is only the matter of practice, engaging your pelvic floor, doing the belly hug, okay? So in a 4-point kneeling, it would be breathing in, breathing out, engaging, imagining to zip up the core. The belly is lifting up towards your spine, breathing in, and breathing out. I have to do it kind of with my hand to show it correctly. Okay, and this is your very, very basic. If you master this, pelvic floor engagement, deep abdominal engagement, aka belly hug, with a regular, proper breathing, this will not 100% eliminate your diastasis recti, but this will teach you to control intra-abdominal pressure, to reduce probably the strain and the stretch on the pelvic floor in your abdominals, and to get back on track of rehab almost immediately, I would say.